Okay, great. Some really interesting insights there from Matthew on the ambition and scale of opportunity to make sustainable change and lasting improvement through tech-enabled care, and exciting times ahead for the local projects and the Innovation Collaborative. And as Matthew indicated in his keynote, please do continue to share comments or queries in the chat function. I've seen people doing that already, which is great, and we'll address them through the Future NHS platform. Up next, we have a fantastic session on the vital partnership between clinical and digital in driving transformational change forward. We were lucky to speak with Natashas Phillips, CNIO, and Gareth Thomas, Deputy CCIO from NHSX, as well as Vaughan Lewis, who is the South East Regional Medical Director and CCIO. The session is facilitated by Chris Richmond from the NHSX Digital Health team. Over to you.
Thank you all for joining this session, a discussion with some of the clinical leaders who have helped implement remote monitoring solutions throughout the country. And we're going to discuss their opinions and views on things around the implementation of technology to support the patients and the people who we work with. So in conversation first, I'm going to go to Gareth Thomas, who works with me at NHSX and has helped us implement some of the remote monitoring solutions in my early stages in NHSX. So Gareth, if I can go over to you to introduce yourself and tell us a little bit about your role, please.
Thank you, Chris, and really good to be with you all today. I'm Gareth Thomas. I'm the Deputy National CCIO here at NHSX. By background, I'm an intensive care consultant in Salford in Greater Manchester. I've been involved with clinical leadership, particularly translational clinical leadership roles for around 10 years or so now. At present, I work in NHSX as the Deputy National CCIO, as I've said, with oversight of programs, particularly around child health and maternity transformation. Where Chris and I first met was about 14 months ago when we were working together in the COVID response clinical cell, which alongside NHSEI and NHSD oversaw a lot of the transformation which we saw during wave one of the COVID pandemic. Part of this was working alongside partners both from industry and local organisations to roll out remote monitoring of oxygen saturations for patients alongside a COVID clinical pathway. So that's a bit about me in terms of my role within NHSX and transformation. The other piece that I'm really passionate about is around the development of professionalisation and clinical leadership in general terms, but also more specifically around the clinical informatics agenda.
Brilliant. Thank you for that introduction, Gareth. It's really great to be talking to you today. So if I can come on to the question, sort of a question for yourself. So based on your experience, both at a local and national level, what do you think are the main critical success factors for building a good relationship between clinical and digital to drive transformative change forward? I think you've already touched on some of those points about the heart, which I think we're really interested to hear your view on this.
Yeah, sure. So, I've been fortunate over the years to work with some absolutely tremendous teams involved in clinical digital transformation. And I think one of the most fundamental principles you have to establish within that team is an alignment around the needs of the citizen and the service. And I think, Chris, this is some of the things that we saw within the COVID clinical cell, and more specifically with some of the remote monitoring work that we were doing. We were really clear on what are those measurable outcomes that we're trying to achieve, and what does the future state need to look like. I think the CCO particularly has a real role here as a translational leader. So understanding again the needs of the service, but at the same time appreciating the varied skill set from all members of the team, understanding how they can contribute to that outcome for the service. I think there's a red flag here that the teams need to think about, and that's avoidance of digitizing the as is state. So there needs to be a willingness to disrupt traditional service models, whilst also managing any associated risks behind that disruption. And you'll remember, Chris, again, when we were doing the remote monitoring work, we used to talk about, well, what's that break glass function? What is it that we can do to maximize safety in the event that we need to revise how our program is running at any particular time? So a willingness to disrupt, but at the same time understanding what those risks are alongside that disruption. I think, again, as a sort of a combined clinical digital team, we need to have a shared understanding of the complexity of the environment in which you're working. It's very rare that these things are done in a stable environment. It's often with a multitude of stakeholders and competing pressures. I think as part of that work, it's really important that we learn from other industries, especially in terms of citizen focus, co-production of information, and the use of real-time data to inform our change. So it's important that the clinical digital team develop a shared vision, but alongside this, it's really important that we have a healthy pragmatism about what's deliverable in the time available and the constraints around us. And again, Chris, going back to our experiences 14 months or so ago now, there was a real time pressure and a need to get on with this to improve outcomes for patients in real time. And finally, I'd say that with these combined teams, we need to have a willingness to fail and to learn together from the program as it evolves, and also change scope and focus if necessary as that program is developing. But ultimately, the combined clinical digital team needs a real focus on what is it we're trying to achieve for the citizens and the service, and how can we get there efficiently and safely and redefine those service models.
Thank you, Gareth. So if I may just ask you one more question on this, so some take home for people. So what do you think some of the typical challenges are enabling clinical teams to adopt, spread remote monitoring technology? I know you've touched on this previously, but what are the big ticket items that you think people would really take home from this session?
I mean, I think one of the main challenges in the program team is being really clear on what it is that we're trying to achieve within a program, whether that's remote monitoring or any type of digital innovation, and being willing to revisit and refresh those objectives as the program develops. I mean, there's this cliche of building a plane whilst flying, and that is essentially what we're doing a lot of the time. We're not working in a steady state. So therefore, it's really important that as a combined clinical digital team, we're able to review our objectives and refresh these as the program develops. I think it's really important that we have a strong approach to governance around the program, whether that be program leadership and how it's constructed, whether that be around information governance, or whether that be around any associated clinical risk. All these things need to be really tightly monitored so that we collectively are clear on how we're managing these aspects of the program. And then I think that probably the final piece really is, how do we demonstrate impact, how do we measure this, and how do we share this for greater benefit across the system? So at all times, having an ability to reflect in terms of what have we delivered, how do we improve on this, and how do we share this more widely and communicate it is absolutely essential.
Thank you for that answer, Gareth. I really appreciate you taking the time to answer these questions for us, and hopefully colleagues within the system at the event will enjoy the input and take some valuable learning from this. And now let's go over to have a conversation with Natasha. So Natasha, can you please introduce yourself and explain a little about your role, your experience, and what areas you are working on at the moment?
Yeah, certainly, Chris. So I am National CNIO for England. What that means is I work as part of a clinical leadership team, the CCIO team at NHSX, and I also work as part of Ruth May's team CNO. And really that is to make sure that we have a nursing voice at the top table in all the digital transformation of the NHS. So really it's about supporting capability building and advocating for nurses. And the reason I do this job, I came to this job mid-pandemic from UCLH, where I was a CNIO. My background is an intensive care nurse. I've always been a nurse that's led a lot of transformation. Increasingly, that's digital. So I would say I'm nurse first and digital second. So when I approach a challenge, my question is, how can we make it better? And then how can digital technology help us to make it better? And the key areas of work that I work on at the moment are, I'm also Director of Safety at NHSX. So I'm leading on our safety strategy, which will be launched on World Patient Safety Day. And other key areas of focus are professionalising nursing informatics, considering an interoperable nursing standard to support the joined up care agenda, and ensuring that chief nurses are equipped with the knowledge and information they need to advocate locally for nurses' involvement in digital transformation. And we'll do that through a What Good Looks Like for Nursing framework to sit up and alongside NHSX's wider What Good Looks Like framework.
That's really good, Natasha. Thank you for that. So if I can just ask you a question now. So as you mentioned in your introduction, you came across to NHSX right in the middle of the pandemic. You know, it was a really big shift at the time, and during one of the biggest shifts in the use of technology in the NHS. How have you seen the nursing profession evolve over that time, and what do you think are the next areas of focus?
So you're right, it was absolutely a transformative shift in how nurses worked, and on one level it made the role easier for me, I would say. So I think pre-pandemic, I'd come to the job not knowing we would have a pandemic, with the mandate that nurses would have the technology and data they needed to enable great patient care, and I knew that the key thing I needed to focus on was capability building and waking up the wider profession, so that it wasn't just about those digitally interested nurses, but much wider engagement in digital transformation. And that included mobilizing our decision makers, our leadership group, our chief nurses at provider level, and moving forward at ICS level, to really see this as an important part of their leadership role in their organizations, so that they could advocate for the nurses who work in their organizations. And I think it's fair to say that there was a very varied economy in how people saw that and felt about that, and a nervousness amongst the profession at that senior leadership level, but also sort of at the front line. We have, a very diverse workforce, and some feeling much more able to embrace than not. I think in my experience of leading change at UCLH, nurses are more up for it than people give them credit for, and they're very capable at adapting quite quickly to embrace change. So when we transformed UCLH, moving from 130 odd systems down to one enterprise-wide system overnight, changing the working life of 3,000 nurses overnight, moving them from paper and lots of systems to one, arguably they were quite terrified. I was quite terrified because I was responsible for them. But they very quickly adapted to them, and it wasn't long before they were saying, please don't take this away because it makes my life easier. And by the way, I think we could make it even better by doing this. And that's not a universal experience of every organisation. Nurses are working in all sorts of settings, many in social care, community care, and they all deserve to have that opportunity to be clinically led, to design systems that work for them, and supported to be able to have the knowledge and skills to embrace them. And I think when the pandemic hit, everyone, mustered, and people were in different stages in how they could do it. But I think the evidence shows that nurses really started to step up. So for instance, the digital nurse network that NHSX hosts, the membership went up by over 100%. It was amazing how many nurses were seeking out, how can I do this? And the digital nurse network targets primary care nurses, and they ran a whole series of webinars. They have an online forum, and you could see nurses supporting each other to adapt, and then starting to think, this is a really good way of working, and I think we should continue, but we need to do more of this or less of that. I think we did a digital maturity assessment as well as part of this process in my first year of being CNIO. And it was really clear, the results were overwhelming, that nurses said digital change had made a positive impact to the way they worked, and they wanted to do more of it. So that was music to my ears. And I guess what I'm saying in perhaps a rather verbose way is, it's made my life, in terms of leading as head of profession for digital, it's made it a lot easier, because I'm pushing more of an open door. We know now that there's a real appetite to do this. So moving forward, my priorities have shifted slightly from the need to make the case for change to the need to really quickly give people what they need. And I think the priorities in that area will be very much around joining up care. So, remote monitoring is a classic example here. I was in the Northeast last week speaking to a nurse who was supporting care homes with technology that enabled them to detect deteriorating patients quite quickly and join that up seamlessly to primary care. And you can see where nurses come into their own here, because we're very focused. It's always been part of our role to join up the system. And what's saying is that technology helps me. And what that individual was doing was not just landing a piece of tech on a non-registered clinical professional to work with, but making sure that they were well educated, well supported, and that it was really adopted. And they had really demonstrable benefits in terms of admission avoidance, getting patients seen by the right clinician really quickly on a pathway, avoiding having to come into clinic. And what really struck me about that was that nurse's passion for nursing and supporting others to do their very best. And so I think nurses have a real role to play going forward. So in terms of what should our priorities be? Yes, thinking about joining up care, thinking about what the new world looks like in terms of ICS, and that we develop a nursing voice within that space, really focusing on new technologies like remote monitoring to empower patients, but not forgetting that we need to lay some basic foundations like EPRs in every organisation that have the right clinical content. So there's plenty of work going forward, I think.
Thank you, Natasha. It's really interesting that you both, yourself and Gareth, have touched on some of the user-centred design pieces here and making sure that the users, and the citizens or nurses or clinicians, are able to do that. So it's really interesting you both touched on that point. So if I may ask you another question, what policy training support will be available to develop nursing digital leaders now and into the future?
So developing nurse digital leaders is one of my key priorities. I set my priorities as CNIO 8, and there are 8 really clear streams in them. 6 of them are very much about the what, the tech and how we use tech to reduce the burden, to improve patient safety, and to improve the patient experience, and enable nurses to spend more time in relationship with their patients. So I think Gareth and I are both talking about we need to reimagine our clinical practice with technology and always think, how can tech be an adjunct and help and support? How might I practice differently? Our clinical practice doesn't stay the same. It's not stagnant. So why would digital transformation be a stagnant, do it once thing? So it is really about thinking about what we do. But there are 2 tenets in that priorities, one of which is empower nurses, and the other is professionalisation of nursing informatics. And I'll take them both separately. So when I talk about professionalising nursing informatics, what I mean is we now have nurses who are specialists, clinical nurse specialists, we call nurses who have a specialism in nursing. These are clinical nurse specialists in digitally enabled care, and they span the breadth of every type of care that we deliver. So we need to recognise it as a specialism and make sure that they have the knowledge and skills to do that, because what that specialist group are doing is helping to lift everybody else up. So in the coming year, working in partnership with HEE, we're devising a programme. So a specialist programme for nurses who want to specialise in nursing informatics, to ensure that we have the leaders of the future. And the sort of content that would be in that are, of course, the core digital elements that they need to understand about cybersecurity, SNOMED coding, those sorts of things that you would expect, but also thinking about quality improvement and using the tools of quality improvement to redesign care with digital technology, and importantly, leadership skills, because what we see from our survey is that we have anything from a band 7 to a band 9 being a chief nursing informatics officer, many of whom have had no input in terms of learning from an educational perspective. It's all on the job learning and to do that role. And we clearly can't leave it like that. We need a standard, we need to protect our patients. And that means making sure we have people practicing at the right standard in order to get the best out of it. So that's the first group. The second, empowering the nurse, is really about what I mentioned when I talked about my role in terms of there are different groups who are not digital experts, but need enough knowledge in order to be able to work in a fundamentally different way as our health system becomes increasingly digitised. And there are a number of groups in that. So for our chief nurses, they really need to understand enough to ensure that they have the right workforce of professional nurse informaticians, and are thinking about the right types of technology to enable care in their setting, and can articulate that at the board to make sure that any digital transformation programme has got nursing at its heart in service of patients. So we're doing some work with that group using the What Good Looks Like framework to essentially give them a recipe book for that, to enable them to have those conversations. It's a vast job being a chief nurse. You need to understand estates and facilities, finance, nursing practice itself. And now we're saying, and you need to understand about digital. And I think it's our responsibility at the centre to provide them with the tools they need in order to do that. And then we've got the much wider workforce. So in the longer term CNIO strategy, we need to start addressing undergraduate and postgraduate education to make sure every nurse entering the profession has a basic grasp of how to use data science, where digital technologies might support their patients, and it's woven into the curriculum. So when you're teaching about doing an assessment of a patient and getting a patient to submit their own data, you understand about how they might use remote monitoring tools, how they might use apps, what are the risks and benefits of doing that, how do I advocate for that, how do I make sure that me as a nurse is still at the heart of that. So there are a number of groups to work on, and it's really probably quite a long-term objective. But the first bit is to start with the professional nurse informaticians, because when we have a strong community like that, they can then work through the wider profession to achieve the bigger picture stuff that we need to do for digital transformation. So quite a lot of work on clinical leadership, because I think it starts with our people.
Natasha, I'm sure lots of people have taken loads away from that. You know, your passion for your profession and passion for your role comes through in all of your answers and what NHS is doing to support that. So thank you for taking the time to discuss that with me. And now I'd like to go over and introduce Vaughan Lewis, who's one of our system leaders and clinical leaders within the system. So Vaughan, can I ask you, can you please introduce yourself and explain a little about your role, your experience, and what key areas you're working on the moment?
So my name is Vaughan Lewis. I'm a paediatrician by background, and I'm the South East Regional Medical Director for NHS England and NHS Improvement. So that covers the whole corner of the southeast of the country, population of 9 million, and I work very closely in the region with my Director of Digital, Jane Barnacle, her team, and medical directors and system leaders from across all 6 ICSs.
Oh, thank you. Thank you for that introduction. It sounds like there's a lot of work and some really exciting things happening in the South East. I know we're working really closely with yourselves on these. So if I may ask you a question around, we've seen some amazing responses from frontline colleagues across the country in adopting remote monitoring technologies. What work are regions doing to support clinicians in making this change sustainable?
So I think it's a really good question, and it's one of the most challenging areas of digital transformation. And recent history is littered with failed implementations, or implementations that haven't delivered what they perhaps promised to. And I think part of that is down to clinical leadership. And I think clinical leadership is a generic skill rather than specific in the space of digital technologies. We were very fortunate in the Southeast in having Natashas Kim, who came up with the idea of COVID oximetry at home, recognised that the early identification of deteriorating patients with COVID and early monitoring was potentially a game changer for those patients, could get them into hospital when they needed to go into hospital early, and those patients who were identified and monitored early when the need for oxygen was established early in the pathway through remote monitoring, those patients, it looks like from early analysis, had substantially better outcomes than those who presented late. And I think there's a theme here for me moving forwards about the role that remote monitoring of patients, often in their own homes, has in terms of the benefits of early identification. The old adage of a stitch in time saves 9 really applies to healthcare too. We've known for a long time that patients with cancer diagnosed at early stages have better outcomes. That's why it's an aspiration in the long-term plan. We know that early identification and prevention of blood pressure helps in the long-term morbidity related to hypertension. So this is all happening at a time when the long-term plan is putting more emphasis on early prevention and detection. And digital technologies are a way of covering large populations in a relatively lean way, provided you've got the infrastructure to support that and the visionary leadership to implement what does represent a significant change for the majority of clinicians at the coalface.
Thank you, Vaughan. Really interesting about how you're approaching this in the South East. And as I say, we work really closely with yourself and Natashas Kim on the early COVID oximetry work, and the national leader in helping recognise that, and now being a clinical champion for this is certainly making it much easier for us. So if I may ask you another question, following on from that. So we heard from Natasha that she's working with with regional teams and how we can embed nursing leadership within the ICSs. If I can build on that point and ask, regional teams already work closely with each local area. How will you continue to build digital and clinical leadership into the formation of the ICSs, integrated care systems within your region?
I think it's a really good question, and of course change is always challenging, and this shift to greater system autonomy through and for ICSs to be taking on more responsibility for the delivery of healthcare across their systems is, I think, both a threat, because it's a change, and change is always energy consuming, but also a real opportunity. And I really welcome some of the early thinking in the ICS design framework around leading system-wide action on data and digital, some clarity around data and digital standards, and an emphasis on a single coordinated offer of digital channels for citizens across the system. One of the things that is really clear to me is that digitally enabled patients are able to access care in a different way. Now, of course, there is another side to that, and we need to be very cognizant of the of digital poverty, and we need to make sure that the systems that we put in place mitigate rather than exacerbate existing health inequalities.
Thank you, Paul. I think that was, again, a really interesting answer, and thank you for taking the time to talk to me today. I'd just like to thank all three members of our panel for taking the time to discuss their views on clinical leadership and how technology can support them with their clinical decision making. Thank you for listening to this session, and I hope you enjoy the next session.
Great, and thank you to Chris and the panel for sharing their views on how clinical and digital need to work in close collaboration to support digital care at home. And that's shone through during the COVID pandemic, as explained by Gareth. You know, it was really interesting to hear Natashas' overview of plans to develop digital nursing leaders, and then Paul's perspective from an ICS and regional perspective on how we need to gear up to optimise the full potential that digital technology brings. So lots to take from that session. We're now going to be joined by Joe Rafferty, who's Chief Executive of Merseyside, and he's going to talk us through the fantastic work they're doing in the Merseyside area to deploy remote monitoring technology into different care pathways.
Laura,